All right, we have no friends working here. I just want to say that. Whitney Houston and CeCe Winans with Count on Me. We're heading to 10 Minutes to Your Health, and online we have Dr. Keisha Buchanan, gynecologist and obstetrician, and she's going to help us address some concerns that pregnant and breastfeeding women may have as it relates to COVID-19 risks. Good morning, Doc.
Good morning. Thanks for having me.
Yeah, thanks for joining us. So, Doc, the concern now is people are thinking COVID-19, how will it affect my pregnancy? How will it affect me breastfeeding? What do you have to say to them?
Well, unfortunately, it's just sort of anxiety. But the reality is most women, the risk of getting infection will be the same as the general population. Most ladies, once you take the social distancing methods, you will not get infection. But most pregnant women will not have any symptoms or just have mild symptoms, just like a cough, cold, or flu. Some women are going to be at higher risk of severe infection, and those are women who are 7 months pregnant or older, or women who have pre-existing conditions, such as women who are asthmatic, women who have heart disease or sickle cell. Those are the women who will be at risk of having the pneumonia and be at increased risk of needing to be hospitalized or intensive care admission. There is a trend now that there's an increase in the risk of premature delivery for some women, but there's not an increased risk of miscarriage or pregnancy loss or birth defects.
All right. I know the data is still pretty much young, Doc. Research is still happening. But a lot of people have been asking if the mother happens to have COVID-19, how will that affect the baby?
Usually,
during pregnancy and post.
There's no evidence that it will spread from the mother to the baby in the womb. So that's one good thing. But as I had mentioned, there's an increased risk of premature delivery. So there might be, but this is really for the severely ill mothers. So some babies might come a little earlier. After birth, of course, you have to take all the methods to prevent the baby from getting the infection, because the babies can also get the infection. So far, there has been 2 cases, a 6-week-old and a 10-month-old that has died from COVID-19, but most babies seem to actually do very well. But you have to try your best to not let the babies catch the infection.
Wow.
Yeah. So how do pregnant mothers protect themselves against COVID-19 and prevent the transmission if they have it to their child?
Well, first of all, the same methods that the Minister of Health has been saying: social distancing, wash your hands often, cover your mouth whenever you're sneezing or coughing, wear a mask, avoid touching your hand, eyes, nose, maintain your social distancing. Unfortunately, this is not the time where we can have those lovely gender reveal birthday parties, or it has to be virtual online, and baby showers. They'll have to have those virtually online. But if the mother does catch COVID-19, we still recommend that she breastfeeds, but if she's with the baby, she should wear a mask. She should wash her hands before and after breastfeeding. Ideally, she should get somebody who's healthy to feed the baby, so she can pump the breast milk or give the formula to the person and encourage that person to ask that person to feed the baby. And try, very sad, but try to maintain some social distancing from the baby for about 14 days. But of course, mommies want to be with their child, so whenever she's around the child, wear gloves, wash hands, wear a mask if you have COVID-19 already.
Wow. A lot of people are anxious. I can imagine that pregnancy makes you anxious, and in pregnancy, COVID-19 escalates. What is your word to mothers at this time in terms of just trying not to become stressed and to put themselves in a mental place where they'll be safe, and the baby will as well?
Well, I mean, definitely we still have to be positive. You know, we have to be positive. This is a pandemic. This is not the greatest time to have a baby, but just be positive and just realize if you take the necessary guidelines, you do your social distancing, hygiene methods, you will not, it's highly unlikely that you'll get COVID-19. But if you do get it, it's most likely going to be a very mild infection. Try not to watch the news excessively and internalize too much. Try to be positive. You can do meditation, exercises, because one of the concerns that we have now is an increase in postpartum depression and anxiety because of this. So just be positive and keep in mind you're unlikely to get it, and if you do get it, it is most likely to be a mild disease. And if it happens to be a severe disease, the risk of dying is still very, very low.
Yeah, I'm glad you raised the postpartum, that because it's, pre and postnatal care are critical. But in times like this, when people are in lockdown, they're saying only essential services are open. I know the dentists are probably down to zero at this point in time. Obstetricians, gynecologists, what pertains for you?
Oh no, when the going gets tough, the tough gets going. And we are dedicated to the care of our pregnant women, right? So we are coming out to our offices and we encourage our mommies to come, continue your prenatal care. It is very important, especially in the latter half of pregnancy. We are taking the necessary steps to protect ourselves and prevent spreading anything to our patients and prevent ourselves from getting things to spread to our patients. And we're coming out, we're going to deliver our women. We're advising them of all the necessary steps to prevent themselves from getting the infection. But if they do get sick, we are going to care for them. We recommend mommies, even women in the lockdown areas, they need to come out to see their doctors. Don't miss antenatal visits. It's very important because that is how we pick up problems early and prevent other complications. Because apart from COVID-19, there are other issues that can develop, like preeclampsia. So we're there to take care of pregnant women, and we want them to come up and see their doctor.
Yeah, thank you so much. Dr. Keisha Buchanan, obstetrician and gynecologist, giving us tips and for pregnant mothers in this time of COVID-19. More on Smile Jamaica after the break. Don't go anywhere.
10 minutes to your health